Hello, and welcome to the premiere episode of Rural Health for You and Everybody, a podcast where we'll be exploring topics relevant to rural health in America, along with highlighting specific health services offered through the Murray County Medical Center. I'm Amber Sorensen, Marketing Director at MCMC, and I'm thrilled to be joined by licensed practical nurse and certified lactation counselor Lindsey, who has graciously taken the time today to talk about lactation consultation services offered at MCMC. Thanks again for being here, Lindsey. Feel free to introduce yourself to our listeners.
Thank you. I'm Lindsey, a nurse at the Murray County Medical Center. I've been a nurse for about 11 years. Worked in pediatrics for a good portion of my career. I've been here for almost 2 years. And then I decided about a year ago actually to pursue lactation consulting just as a passion of mine over the years of having my own kids and having experience with lactation consultants for myself. And so just something I wanted to bring to the community just because we don't have a lot of it here in the area, especially talking with public health and stuff like that. It's something that I thought we would definitely be able to utilize in the county just because we don't have a lot of access to it.
And what services do you offer specifically as a certified lactation consultant, and when might be a good time to seek out those services through MCMC?
So the services that you offer, it can be anything specific. It'd be like weight checks, or obviously checking to see how your latching is going, and basically any breastfeeding concerns. So whether that be like for the babies, like I said, concerns about lack of weight, concerns about latching, any birth defects that might have affected breastfeeding, or the mom, maybe the mom has anxiety or fears about it, or has had past struggles and just really wants to do better this time. And so it's kind of just helping that when we can do it at a good time. Really, it can be anytime they have a concern. They can, I'm perfectly willing to give my cell phone number out, and just like anytime, 6 o'clock at night, they might have concerns. Or the nice part about it is we have access. So for the well childs, it's something like if they just want me to pop in quick and just do some questions, or basically anytime they have a concern, they can call. We can do a nurse visit, we can do a telephone call, or again, we can do it at their well child visit. So anytime they need assistance.
So not necessarily a formal appointment that has to be made.
Yep, no, nothing. Yeah, and they can call anytime. Yep, and it's nothing like once a week, once a month, anything like that. It's just specifically when the mother feels she has concerns, and that's what I'm here for.
In your opinion, what would some of the benefits of seeking out those lactation consultation services be?
So really, a lot of it's just peace of mind. So there might be something wrong that they don't even see. It could be like a lip tie, or the baby's mouth is turned incorrectly, and it could be an easy fix that's causing them to have all this stress. And sometimes they just need to come in, and we can tweak little things or big things, and it's going to make a huge difference. And so those are a lot of benefits to it, because sometimes they might think that, like they're crazy and this is working for everybody else, but it's not working for them. And it might just be something simple that we can fix real quick, or it might take some time. But it's just a lot of it's just a peace of mind, telling moms that they're either doing something, they're doing everything right, and this is just going to be a little bit of a struggle to get through, a little bump in the road, or we can fix something that will make it a ton easier for them.
And how would you probably say that the services offered here and through the rural health clinic, specifically at MCMC, are different or maybe better than those that individuals may receive elsewhere from more of a larger city?
Sure. So, I've had a lot of experiences myself as a past breastfeeding mother, and they've all been amazing. I think that the biggest difference here is I really haven't seen it a lot in a clinic setting. First-time moms are busy. Moms with 5 kids are busy. They don't always have time to go to the hospital or go to a different facility, and sometimes they're already at a well child. They have to go. Those are scheduled appointments, and sometimes they might just have a question that they don't necessarily want to make an extra effort to seek out the answer for. So I'm there at their well childs, at their visits. If the provider has a question, the provider can come ask me. And so, and that's another thing, is we have direct access to providers. You know, you're not coming to a hospital setting where you're talking to the lactation consultant and there might be a concern that warrants a visit with a provider. They're there, you know, and it might be a dual visit, like they're at the well child and then I might help and then the provider can help with their part. So it's kind of taking out an extra step that I think that sometimes, especially busy moms and busy families, just don't have time for.
How would you suggest that individuals prepare for either maybe bringing those questions at a well child visit, or if they do decide to make more of a formal appointment with you specifically, how would they prepare for that?
There's really not a lot of preparation for these kinds of visits. I think that the most important things would be to come with an open mind, make sure you have your questions. Prepare for some different techniques and stuff like that you might not have tried. The biggest thing I think as far as preparation would be is maybe come with a hungry baby, you know, so that like if we want to do a breastfeeding assessment while the mom is feeding, that, you know, like that the baby's hungry and ready to feed and eager, so that we can properly assess it. But otherwise there's not really a lot of preparation that would need to go in with the visits.
Sounds good. And do you have anything else to add about lactation consultant services at MCMC in general?
I think that the biggest thing that I want to emphasize is that I am here to meet the moms and the family's goals. I'm not here to set goals. Like, I don't expect every mother to breastfeed their baby until 1 year or 2 years. If their goal is to make it to 3 months, or if their goal is to make it to 6 months, or just farther than they did with the last one, I want to help them with that goal. I don't have goals preset for anybody. Everybody's different. Some people want to make it to a year, somebody want to do it until their kids are 5, and I want to just help them succeed with as far as they're wanting to go in this. And so there's some people get nervous thinking that lactation consultants or doctors are going to think this is what's best. You have to do this for X amount of years, X amount of days, and really we're just here to help you make your goals possible.
Very good, very good. And if people want to get a hold of you, can they just give the clinic a call?
Yeah, they can definitely get the clinic a call. If there's more feeling like it's going to be after hours kind of stuff, I'm definitely willing to give them my cell phone once we actually have that first initial conversation. But you can just call the clinic at 507-836-6153, and you can just give me a call and we'll go from there.
Sounds good. Thank you for your time, Lindsey.
Thank you.